Welcome to Neurology News Network. I'm Jenna Pasco.
And I'm Matt Hoffman. Let's get into the news from this week. A cross-sectional analysis has revealed some troubling data regarding patients with comorbid Parkinson's disease and dementia. Never events in medication prescribing appear to be more common than previously thought. The never event in question was the co-prescription of a high-potency anticholinergic medication and an acetylcholinesterase inhibitor, which can result in pharmacologic antagonism due to the drug's opposing mechanisms of action. Ultimately, after including data from more than 250,000 patients, the investigators found that this inappropriate co-prescription was occurring at a rate of nearly 45%. These errors were seen across the United States, with clusters of high prevalence in the southern and midwestern states.
Speaking of acetylcholinesterase inhibitors, despite showing beneficial effects on 2-year score changes for multiple questionnaire measures, donepezil failed to make a preventative impact on psychosis development in patients with Parkinson's disease. According to the authors, the findings suggested that ApoE4 may be suppressing the antipsychotic effect of the therapy, and that ApoE4 carriers may be more likely to have comorbid amyloid burden, which causes a cortical dysfunction leading to the suppression. They noted that physicians should look at the condition of patients and pay attention specifically to detect psychotic symptoms, as systemic inflammation or trigger medications such as ametanine dopaminergic antagonists or anticholinergic drugs cause of psychosis. Checking for these factors at the presentation of hallucinations is paramount.
Parkinson's disease, as many are aware, is a difficult disease to treat, and receiving the diagnosis is not usually easy for patients. However, despite an inability to cure patients, there remains a need to keep their quality of life as high as possible. In a conversation with Dr. Neepa Patel, a movement disorder specialist with the Henry Ford Health System, she mentioned her desire for physicians to keep this in mind. For her, there are still options to help patients have an improved quality of life despite their condition. She said that she thinks there's still a lot of opportunity in these pretty devastating conditions, and many great symptom-based therapies that can improve quality of life are available. She stressed that thinking about quality of life is an important part of treating the patient, and noted that there are a lot of new therapies that can be used to help them, even though they're not necessarily helping change the disease just yet.
Dr. Roberto Espay also wants clinicians to think differently about Parkinson, although this hope is that the thought process will evolve into thinking about the condition as a result of many molecular processes occurring over time.
And he noted that in order for the growth of therapies and biomarkers to become truly successful, this altered way of thinking about the disease really needs to be addressed. Then, therapies for specific subtypes of the condition can be developed.
In a conversation with Dr. Espay, he explained how this thinking needs to change in order to truly have disease-modifying therapies. Let's take a look.
For us to make progress with Parkinson's, we will have to alter the way we view it. And although most of us recognize that Parkinson's is probably many diseases, we're still insisting for the purposes of developing therapies and also in the related aspect of developing biomarkers that Parkinson's is a unity. It's heterogeneous, we say to ourselves, but it's an unity from the standpoint of all different mechanisms that have ever been reported to be abnormal. Parkinson's somehow have a relevant role in just about everyone with that clinical diagnosis. If in the future we were to begin to tease out different types of Parkinson's, and there is a big deal of interest, for instance, in specific genetic forms of Parkinson's, such as GBA, and targeting GBA pathways in terms of what they do to the degeneration, we might be able to begin the process of truly coming up with successes that will apply to just these very specific subtypes of Parkinson's, but not others. And perhaps we just need to accept the fact that there will be a success, but that success will come only when A, we accept that it'll be applicable to a subtype, molecularly defined, and B, that it will not serve to anybody else that's sharing the same diagnosis.
For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.